From Isolation Studios, it's Richard Crouse.
Welcome, everybody, to In Isolation with. I'm Richard Crouse. I hope you're staying healthy and staying happy. My guest today isn't a psychic, but 15 years ago, in a book called Pandemic, he wrote that the world was well overdue for a killer virus. On In Isolation with this week, I speak with Daniel Kalla, an emergency room doctor, the head of the ER department at St. Paul's Hospital in Vancouver, and if that wasn't enough, he's also the author of best-selling books, including his most recent novel, The Last High. We talk about his pandemic prediction, why we've been lucky as a planet, and if he ever feels like a character in one of his own books. We start, as we do with all these In Isolation interviews, by finding out where he is right now. Let's get to know Daniel Kalla.
In my home office in Vancouver.
Now, you have a different perspective on this pandemic than anyone else that I've had on the show, because you are a doctor, you've been working in the emergency room, but you were meant to be on sabbatical, were you not, to work on the next book? So tell me a little bit about what the last couple of months have been like for you, because certainly you're used to the hustle and bustle of an emergency room, but this has to be a different level.
Totally. I mean, that's so true about my sabbatical, and I had the world's worst sabbatical because, I really was putting some time aside, and I didn't have any clinical shifts, but being department head, I tagged somebody to cover for me for a month, and I thought I'd be just some nuisance calls or whatever, but it just exploded in March, and we had no choice. And of course, and yet in an odd way, it was some of the most fulfilling as an administrator, hospital administrator on the front line. It was the most fulfilling role I've ever had. We didn't know what was coming. Our hospital was so amazing, like so many others. The staff just rose to the challenge, and we collaboratively transformed our emergency room into a COVID-ready unit. And so it was, I was really proud of what we did, but it wasn't much of a sabbatical.
What are you learning through all of this? Because I think you have written about pandemics before. You've written about the Black Plague. You're a bit of a history nut, so you're
totally.
You know about this. What are we learning about ourselves right now in this one?
It's very true. I do consider myself a bit of a buff, especially a bit of a pandemic fanatic, if that can be described, because I've written about the Black Death, Spanish flu, all of them really, and speculated on fictional ones. And one thing that's very interesting to me is historically, like, people don't really realize the Black Death, which is the worst cataclysm to ever hit mankind, also produced the Renaissance. There was good that came out of the Black Death. The lower classes were empowered, sadly, because so many of them died. The stranglehold of the superstition on the church was released. And there was enlightenment after the Black Death. And even after the Spanish flu, the Roaring Twenties came, and there was good things that come from it. And I'm kind of hoping, after all the exhausting, tragic stuff we've seen the last 2 months, that there are indicators that some good will come out of this. I think pandemics bring out the best and worst in people, just like any, crises does. And I'm hoping we'll learn from this and get our priorities maybe a bit reset. And so I have hope.
Yeah, I think you used the word reset, and I've been using that a lot lately. It feels like a reset. It feels as though in isolation, I'm not going into work. This is where I work right now, my home office. And you have time to think. You have time to think about what's important and what isn't. And all the little things that I thought that I might miss, there's a lot of it that I'm not missing. Way. And that's so interesting. That's been an interesting process to go through. And it will make me think twice about a great many things once this is all over.
I think that's so right, Richard. I think this is the only existential threat our generation, any generation who's alive, is right. Nobody has really lived through the Spanish flu or even the Great Depression. If they did, they're very old. But this has been the first threat. And I think you're right. I can't believe, because it's not just healthcare workers. I see my friends who work in real estate and in law and other industries, and they're getting hit economically so hard. And so few of them are really complaining. They're focusing on the priorities of their family. They're worrying about their future. But there's a kind of stoicism and a kind of, collaborativeness that's coming out of this, that, because we've lived in a time, as you know, of so much tribalism over the past few years, and so much materialism. And I'm kind of hoping people will go the other way and realize what is important. you know.
Now, when you do go into work, do you go in expecting loss, devastation, things? I mean, how do you steel yourself for that?
Yeah. Well, the worst parts for us in Vancouver was the first month when we didn't know if we were going to be the next New York or Italy. We've been so lucky, even compared to Ontario, and especially compared to Ontario and Quebec. We've had great management. Our government's done a very good job in BC, but we just had sheer luck, and we have so far avoided the worst of it by far. Our curve has been very flat. We're seeing very little COVID patients right now. So, if anything, we have COVID fatigue, but we didn't have the worst that so many people did.
Well, 15 years ago, in your novel Pandemic, the main character knew that the world was overdue for a killer flu of some sort. Now, this isn't a flu. Let's make sure no one misunderstands it. This isn't a flu. Now, you say that you don't have psychic powers. You say that it was predictable. How so?
Well, it's comparable to me predicting another major earthquake and not telling you when and where it's going to happen, or there'll be another tidal wave. Of course there's going to be one. And what embarrasses me is, for all my research and all my knowledge about pandemics, I was as shocked as the next guy when this one actually showed up, right? But historically, we should have been prepared that we were way overdue for a bad pandemic. We haven't had one since the Spanish flu over 100 years before. So it doesn't take Nostradamus to know another one's coming. And frankly, I have to say, society, healthcare, governments, our pandemic planning all could have been better. We were all caught a little unawares on this one, I think, in my opinion.
Although you say that, but you also say we've actually been fairly lucky as a planet so far. I mean, we're certainly in recent history. How so?
Well, I mean, the worst thing we've seen, we've seen obviously HIV and some terrible infections, but in the scale like you were talking about, because coronaviruses, apart from SARS, are so unique to cause this kind of threat. But the bad flus, I mean, even the bad pandemics of the 50s and the 60s, the Hong Kong flu. You remember when H1N1 came along and everyone thought we were going to be devastated, and it turned out to be not much worse than your average annual flu, right? And so we've dodged a few bullets, and we should have seen this one coming to a degree.
Now that we are in it and the world has changed, do you feel like you're in one of your books?
No, I tell people I wish I was in one of my books. They have happier endings. They never get this bad in my books. Over 300,000 dead as of today, Richard. Right? And it's So yeah, it is surreal though to have written and tried to imagine the kind of sense of uncertainty and that horrible sense of I could be next and everybody's vulnerable. I always tried to put that in writing and in my characters and convey that, and now to feel that at work and with my family, it's surreal.
Your new book, The Last High, is about the opioid crisis. One last question about the pandemic. Do you think, or do you fear, that substance abuse, for all the good stuff that's going to come out of this, do you fear that substance abuse is going to be maybe another crisis that arises out of this pandemic? People have a lot of spare time.
100%. That's a great question. First of all, as I'm sure we'll talk about, the opioid crisis is a terrible epidemic on its own. And we were just in Canada starting to make some gains against the horrible loss and deaths we've seen. And we already see with COVID that there's new spikes and overdoses going on all across the country for a number of reasons. But I think you're deadly right. I think more people, out of despair, out of economic tribulations, troubled times always pushes people towards substance abuse. And I think we're going to have a rash of mental health and substance abuse issues in the wake of COVID, to be honest with you.
Now, The Last High, you say that you wrote that to sort of encapsulate your experiences working during this opioid crisis as a physician. You want to warn people about the risks. Couple of questions, though. What do you see in a day-to-day way in terms of fentanyl and other opioid abuse? And then the follow-up question to that is, how do you warn people against something that they probably already know is really bad for them?
I know. Well, okay, let me tackle the first ones, because in day-to-day, where I work, there's not a shift where I won't see at least one or two fentanyl overdoses come in. On a Friday or Saturday night, it might be 5 or 10. And those are the lucky ones. Those are the ones that someone got to for the most part and gave the antidote naloxone and were resuscitated. So they weren't alone when they're found. Although some of them do come in and their heart restarts, but their brains don't survive, and which is tragic. Obviously, I also work for the ambulance service as a consultant, and I'll get multiple calls in a day about this person found by their partner, by their parents, by their kids, overdosed, and it's too late. And it's so tragic. And I see in St. Paul's, our regular clientele, our substance dependent patients in the downtown east side, they just, we used to see them time and time again. We got to know some of them, and they've just, so many of them have disappeared over the last 5 years, with 12,000 deaths in Canada in the last 3 years, most of them young. And sorry, then the next question.
Well, how do you warn people against something that we know is not good for us? I mean, it is like smoking. We know that's not good. Drinking, but how do you warn someone against
Yeah. Well, first of all, I mean, that's a great point, because people, I think, are relatively aware, but I don't think they're quite aware, because comparing the risk of smoking or drinking is like comparing the risk of playing with a BB gun versus playing with an AK-47. This is something that can kill you the first time you use it, the second time you use it, the 15th time you use it. And just lecturing, especially, I really try to reach some kids. I'm hoping parents and teenagers and 20-something-year-old will read this book. I mean, hey, because I hope it's an entertaining story and a pretty good whodunit, but it is meant to be a cautionary tale. And I'm sure you as a pop culture expert, Richard, will remember the Scared Straight series of about 20 years ago. You remember they took those young juvenile offenders and they took them to Rikers, and they brought out the most hardcore lifers, and they would yell at them. These convicts would yell at them and tell them all the terrible things that were going to happen to them in jail once they got there. And the idea was to scare them straight. This is exactly, I'm trying to be the novelistic equivalent of Scared Straight. I'm not telling them anything. I want to show them what happens, what really happens. The young people who didn't even realize they were taking opioids, the casual cocaine user whose cocaine is contaminated with fentanyl. They're all at risk, and I want them to see that there are huge consequences.
There are many kinds of opioids, but fentanyl is the one that we hear about, I think, probably the most. And it is deadly, and it seems to me kind of random because of the way that it is sold. There's no, and this sounds terrible, but there's no quality control. So you might have a pill that has some fentanyl in it. You split it in half. One person dies, the other one doesn't, because all the fentanyl was in one side of the pill.
That is so true, Richard. And I go so much into the mechanics of that in the book, just how bad. I use that term all the time, the lack of quality control. It's cooked in these terrible kitchens. They mix them with God knows what, powders and pills they can find. There's no consistency to the potency of what they're giving. They add these ultra potent fentanyls like carfentanil, which can kill blue whales, and so every time you use, you're not getting the same dose. And you hit such an important point. I mean, we saw heroin users for years, and at least with heroin, they roughly knew the dose. They still overdosed and died. But with this, the death rate's gone up 700, 800%, because it's, like I say, it's like going from the BB gun analogy to the AK-47. You just can't play with this drug.
Do you ever feel, as a doctor, working with people that are coming in with fentanyl overdoses, I'm told that contact can be deadly with it. So are you ever concerned for your own safety?
No, I mean, there was a fear with like the carfentanyls, the ultra potent fentanyl analogs, but even still, that's the skin absorption isn't great. So no, we don't fear. It's not from a biohazard point of view. The paramedics often are when they go into people's houses and stuff, and the fumes that they might inhale. But when they come to emerge, it's not a fear for us, no.
Now, this novel has a medical side. You have that part covered. How do you do the criminal side, the research for all of that? And did it open your eyes, whatever you would have learned from that?
So much. That is so good. I have this old hockey friend who is the toughest and best hockey player I worked with, and he turns out, and I'm not allowed, I mentioned him in the forward, but I'm not allowed to identify what he does exactly. All I can say is he works in drug enforcement in Greater Vancouver with the police. He gave me a crash course on this world, and it was staggering. I had no idea the depth of the underworld. First of all, the stupidity, the short-sightedness, the greed, but the organized and disorganized crime that goes on. And as you alluded to earlier, people always ask, why would dealers switch from a product like heroin, where not many of their patients or clients die, to fentanyl, where a huge portion of their clients die? Well, a kilo of heroin and a kilo of fentanyl cost the same to produce, about 7,000, but you get about 100 times as many hits out of fentanyl. It's worth like $1.6 million on the street versus $70,000. The economics for them, the greed and profit is so high. So he just gave me this, just the gang culture is fascinating in Vancouver. I had no idea. And, Vancouver, I'm so proud. It's my beautiful city and I love it so much, but it has a dark underbelly. One character in it jokingly says it's a 6 dressed up as a 9, but, because it has that dark side. And so it was to have my eyes open to the criminal distribution and processing of fentanyl was just, for me, it was fascinating.
And that kind of detail is the sort of thing I think that makes these books feel texture, feel a little different. I mean, I think you have to learn something from this. The whodunit part, absolutely. You need all that, try and figure it out. But you have to walk away thinking that you know a little bit more than you did when you cracked the book open.
Yeah, I sure hope so, Richard. I've never felt stronger in a novel I've written that a message will be taken away from this. Like, I honest to God believed that the story could happen exactly as I wrote it tomorrow. I mean, it starts with 5 kids dying at a party, not even realizing they were taking opioids at all because their drink was spiked. And, and goes from there about this terrible product that's hit the street. And, there are sporadic stories like that all the time. And I think we're at risk every day of that happening. And, and that's why I want parents and kids to be aware of that.
Now, in 2016, and I'm going to read this so I get it right, British Columbia officially declared the opioid crisis, a public health emergency, while the Canadian government estimates there have been more than 9,000 current opioid-related deaths since then. 94% of them happened by accident. I mean, these numbers are sobering.
I know. And what's even more sobering is when you look at the average age of death, Richard, they're like early 30s. So, you take the people who do it accidentally, who don't even realize they're trying it, or first-time users. You take the most hardened addicts, and none of them choose to be there. I wish we could stop stigmatizing it and realize it's a genetically inheritable disease. And many of them, with the right effort and the right treatment programs and the right support in the community, might have kicked this habit, but they didn't get the chance because they died and their parents buried them. People I don't think, realize the level of this tragedy and how far and wide it reaches and all the people it touches.
Do you think that any of the lessons that we've learned in the COVID-19 battle could be applicable to the opioid crisis battle, which will continue and I suppose ramp up again once all this is done?
You're right, because I think opioids will be with us long after COVID. So I think you're absolutely right. We were starting in BC in particular, because we're kind of the epicenter, Canadian epicenter for the opioid crisis. We had put a lot of efforts into harm reduction strategies, and we were making some gains. But it's the kind of consolidated, focused response that we put to COVID in the pandemic. If we could apply that to opioids, I know it's expensive and I know there's a limited resources, but it's a worthwhile investment. And then maybe we could apply it to homelessness and mental health issues and other issues, and really make some permanent gains rather than just some temporary, wins. And so I really think we could learn a lot from how we're managing COVID.
Do you think that when all this is said and done, that your next book will be pandemic related, or do you think people will be like, I don't want to hear about it
now? Richard, I don't care what people think. I don't want to hear. If I could go the rest of my life without hearing COVID or pandemic again, I'd be a happy man. Yeah. So I am not, my next book, I promise you, will not be about pandemic.
Does the daily 7 o'clock cheer for healthcare workers, does it mean a great deal to you?
Yeah, so much. As I said, I've never, as medicine, I'm a 3rd generation doctor and I sort of fell into the profession. I've always been, relatively proud and satisfied with my job. But it's not been till this that I've sort of viewed, especially, so many of the people I work with, the nurses, the cleaners, the clerks, as kind of heroic in what they do, like comparing it to the military, and despite the risk, going in and facing it. And so I have a huge, brand new level of respect and admiration for my colleagues. And then the way the public's responded, with that cheer that we can hear, it's so loud when you're downtown at my hospital, St. Paul's. It makes you feel so good, like the public has your back, and it makes the job easier, and it makes me even prouder of what I do.
I don't know if it will continue in the physical sense after all this is over. I don't know if people will be banging on pots and pans, but I've said on this broadcast a couple of times that I'm hoping that the spirit of that stays with us. So maybe we don't have our pots and pans hanging out the window, but we move forward with an appreciation of people that maybe we took for granted before.
Yeah, that's a very good point. I think attention spans are short. I'm sure we'll move on, but I think this one thing, I think COVID is going to be burned into all of our memories, no matter what happens to it, for the next 20 or 30 years. And I think it will have impact on our levels of appreciation and just our assumptions about what we can expect in life,
One last question. Do you have any hand washing tips for people? Do you do it differently
Yes.
than anybody else?
Yes. As one OR nurse screamed at me in medical school, get the thumbs, get the thumb.
It's all about the thumbs.
It's all about the thumbs. People don't wash their thumbs enough.
Daniel, thank you so much for this. Congratulations on The Last High. Are you working on a new one now?
Yep. I have a new one coming out. Yep.
And do you have one going, a new book going sort of all the time? Is this part of the way that you decompress after a long?
Yeah. Well, ideally I do, I finish a book, I take a break, and then, because there's always, as you publish lots of books, there's always that long delay between when the book actually comes out. And I love after 6 months to go back and be working. Unfortunately, I have just finished a manuscript, and it's such a great decompression. It makes my two jobs, each one, they complement my two careers so well. It makes each one better. So I hope I can keep doing that.
Well, I hope so too. Daniel, thank you so much.
Thanks so much for having me, Richard.
That was Daniel Kalla. You can find his book, The Last High, wherever you buy fine books. Well, that's it for today. My thanks to Dr. Kalla for the hand washing tips and for all the work he does as a frontline worker at St. Paul's in Vancouver, British Columbia. Most of all, though, my thanks to you for joining us. I hope you're staying healthy, staying happy, and staying safe. We'll talk again soon.